Hello and welcome back. Question to ask yourself is, so you're in therapy for a while, and whether it's going really well and you feel you're at a natural end, you've come to a natural end and you kind of think, I kind of want to move on, or if you're not happy with your therapist and you want to move on, how do you end? Because there could be some issues in your life. Some of the things in your life may be fear of endings, and that's a really valuable thing. As I said in the earlier video there, it's worth always bringing that to the therapist. But if it doesn't feel safe, obviously, you don't do it. You can basically end therapy anytime you want, anyway, anytime you want. So, regardless of whatever you've agreed in contract, etc., they're not legally binding. They're only there to protect you and the therapist. But I would say, I would encourage you to basically respect the, whatever the agreement is. So if they want you to cancel, if the contract states, my contract states cancellation policy of 48 hours. So that means that if you cancel inside of 48 hours, I can't give that slot to someone else. And so someone else kind of loses the slot. So we kind of don't want to do that. We don't want to cause other people to lose out on therapy. So in that sense, I would say to you, if they say 40 hours, cancel. Don't. It happens more often than you'd imagine that people just don't return to therapy, which is absolutely, it's part of the course. People expect this kind of thing to happen. Therapists always expect this kind of thing to happen. It doesn't feel great because we don't know what's happened. Sometimes, did they get in an accident before they came over? Because there's all this other. We don't think that, we don't want you, we don't want any harm to come to you. So we don't think in a way that they're just letting me down, or they couldn't be bothered, or they don't go that way. They go, oh, I hope they're okay, and maybe and I will certainly do this. So usually after I've waited 15 minutes, if the person isn't coming, they're not going to come, and then when the hour is up, I'll send them a little text. Just as this is part of my contract, I'll send a little text to say, you didn't turn up for your session, I hope everything's okay. And if they don't come back to me, then I'm really worried. Then it moves on to a different thing. But if they do get back and say, no, everything's fine, had a little tip in the car, forgot all about you, I was trying to sort it, that's fine, that's brilliant, we'll feel really relieved with that. But if it's you're leaving, there's something missing here if you block the therapist, or if you don't talk to them again, or like that, because they're not going to come after you. It's not going to harm you. So I'd say to you just to contact the therapist in whatever way you feel comfortable. If it's a text message, an email, a voice note, try to keep to their, if they have a certain amount of cancellation days they need, try to keep to that. If you can't, obviously you can't. Sometimes if you're coming through your 40 hours and you're just exhausted and you just can't face it, send them a text then. Well, just try to make sure you've ended it, that you're happy with how it ended, rather than you're down the line, you never turned back to it. And that happened to me. I'm not blaming anyone, because I went to therapy years ago, and the therapist was fantastic, but I couldn't see it at the time because I wasn't there yet, and I just couldn't face going back. But it was my stuff. I know now, when I look back, the reason I couldn't go in was because I knew he was fucking good, and I would have to feel pain and discomfort in the room, and I just wasn't ready. And I remember going to the door of his office and just looking at the door and then walking past, and not texting him, not ringing him, not telling him I had cancelled. And now I'm a therapist, I'm kind of going, now he wouldn't have minded, at the end of the day it'd be like, okay, it's ended, we'll move on. But it's really nice to be able to say, I'm safe, I'm good, I'm happy enough, maybe I don't feel it's working out, let's move on. It's not a breakup. They're not going to go, oh, but I love you, please come back to me, what can I do to make it better? If you've decided it's over, it's over. You have the power. So really, just how you end the therapy session is more about how you end the therapy session than what it does for the therapist. And the reason is you want to go and be happy. I ended that really well, I feel, and that could be therapy in itself. So all therapy helps you. So the beginning of therapy where you have your talk, in the therapy where you're doing your process, and ending therapy, all are really beneficial. So how you end therapy reflects how you are in life, for example. So if I don't bother texting that person, I could be in a work and just go, I don't want to go into work again, and walk out, and that could really affect you in your life down the line. that when people get together or those reports where you're looking for references or something like that, then they could go, "You've kind of didn't turn up, didn't give us the 2 weeks notice, didn't give us the, he's not very reliable." So the way you end therapy will be how you are in the world. So if you end therapy well for you, as in keep with their boundaries, keep with their system, and then you kind of go, right, okay, going forward, I really enjoyed that. That worked out much better than I did. And then maybe outside of the therapy, you can go, oh, the reason I do that is because, and you'll pinpoint exactly when the reason you don't like endings. It could be something like a death in the family that was kept from you, or a death in the family that was so sudden you weren't able to grieve, and it could be something very that you don't realize at the time. It could be very connected to emotionally here. So how do you leave? Essentially, you can just leave. You just don't turn up. But I would say to you, use your leaving ending of therapy to your benefit. And that is just complying with everything and see what that brings to you. Because I think not, say, ending therapy abruptly and not texting, not communicating, and not telling the therapist you're ending will harm you more than the therapist, unfortunately. So it's really important that you do it. And I really hope that helps, and it's not too vague in that sense. Anyway, sure, I'll talk to you soon.